It's been really weird and really difficult.
Tiffany Mullins' 6-year-old son, Lincoln, was diagnosed with leukemia a year ago.
I'm transcending on both of these sides that I don't necessarily want to be on.
An MUSC nurse herself for over a decade, it's news she never wanted to hear. But she knew the right doctor could make all the difference.
And it's just a huge breath of fresh air when I see her walk in the room.
Mullins is thankful to call her own colleague the right woman for the job.
She's a pediatrician, she's a mother, she's a doctor. She goes above and beyond to take care of her patients.
That woman is Dr. Nicole McCoy.
To see him grow and, fight and now doing so well, it is so heartwarming, and I have a lot of patients who I take care of with these amazing stories, and it's definitely one of my most favorite parts of my job.
And along with the Lincoln's treatment, Dr. McCoy revolutionized something else, too. Bone marrow transplantation, the very procedure used to treat cancer patients like Lincoln, can be a painful process for donors. But thanks to her, that's no longer the case.
It's so important to have a large pool of bone marrow donors so that we can, ideally provide every patient who needs a bone marrow transplant with their available match.
This transplant is essential for treating blood cancers and disorders like sickle cell disease. But the pain involved makes it hard on donors and even prevents some from giving altogether. That is, until now.
We know how to make your pain, much less or even eliminated immediately after this procedure. So for that reason, you should not be hesitant to donate.
In 2 years' time, a study with over 30 patients helped her create a whole new protocol.
Actually, here in the recovery room,
reducing both post-procedure pain and the amount of opioids needed in recovery.
It was absolutely amazing how successful the project was.
Now that research is making its way into hospitals across the nation.
We have been educating other institutions around the country, some really amazing pediatric anesthesia departments and oncology departments, about using our protocol for their patients.
It's a feat that amazes patients like Mullins, too, who's glad to put her son's health into the hands of doctors like McCoy.
So the fact that we have, our female anesthesiologists top changing the world, literally changing what's possible, but changing the world, is huge to be involved in that.
In Charleston, Megan Fee, Count on 2.